So today I'm with Dr. Gavin Macgregor-Skinner, and I wanted to talk to him about an article I saw. It was originally in the New York Times, and it was reprinted in a magazine I subscribe to that comes to my home. The article is, "When is a pandemic over?" Good question, I would say. But Gavin, tell us a little bit about what you know about what is a pandemic. I know we've talked about that before. It's interesting stuff.
Well,
What is that?
yeah, that's a good question, Jeff. The definition for a pandemic was changed by the World Health Organization that has its headquarters based in Geneva, Switzerland. And that the definition now is based on location. It's not based on risk. It's not based on the number of people that get sick or the number of people that die. It's not based on transmission. It's based on location. And for a new novel virus like this SARS-CoV-2 coronavirus to be declared a pandemic, it needs to be on two continents. We need to be seeing local community spread at the neighborhood level in countries on at least two continents. And that's the definition. And it's really important because when a pandemic is declared, this is the trigger mechanism which opens up lots of resources, money, people, staff, space. And so a lot of countries didn't react. A lot of hospitals didn't get ready because that pandemic declaration hadn't been made. And it's so important that we have to change the system and not rely just on location, but look at what's the risk for 7 billion people that have never been exposed to a virus like SARS-CoV-2.
Yeah, so when this first started, I could do the research, but maybe you know this. Wasn't it in more than two continents before it was a pandemic?
It spread very quickly.
Yeah.
Well, I think it's really important to go back and look at those timelines of January, February, March. Again, the challenge we have, Jeff, with a new virus, of any new virus, spreading to new countries, we don't have the diagnostic tests in place. They have to be developed. Mm-hmm. They have to be, the quality assurance has to be done. They then have to be manufactured. They then have to be distributed. People have to be trained on them. All those critical components weren't in place to identify local transmission of this disease. So we were really basing it on what we knew about symptoms. And at that stage, it was, again, the symptoms of fever, cough, or breathing difficulty, or pneumonia. And that was it. Now we know that COVID-19 has so many different systems and invades so many of our bodily organs and our parts and causes just a plethora of stuff now when it comes to symptoms. But the challenge is with any new disease is moving quickly, but moving quickly to get data and information to make appropriate decisions. And again, we did a lot better than we've done in previous outbreaks of pandemics or new diseases. But again, we've got to move much quicker than, and as we've seen with the deadly consequences we've faced, both not just with diseases, but with the consequences on our economy and how people are suffering right now.
Yeah, it's all that, isn't it? This article talks about that some pandemics have ended because people grow tired of the panic mode and they learn to live with the disease. It wasn't a medical ending. They just got tired.
And that's our big challenge we're going through right now is fatigue. It's summer. July 4th's coming up. That's a day to celebrate. What does the new normal look like? We've already seen cities that have postponed their gatherings, rightly so, postponed fireworks, rightly so, but we've actually got to work out how do we do this in a way that we can keep that physical distancing. But the challenge is right now is that people become fatigued. They want to get back to the old normal, which was 2019 normal, and not look at the new normal of 2020. So we've got some real fundamental challenges, both from the local neighborhood community level, but also from the cleaning industry of how do we actually maintain this high vigilance of wearing the appropriate personal protective equipment, every day conducting risk assessments, but then more importantly, ensuring that we buy the right cleaning equipment and the appropriate disinfectants, and we use them in a way which, again, is a lot more work for us, but to break that cycle of transmission.
Yeah, I know that if I were working in a facility in charge of cleaning, I would make it a matter of pride to protect the people in that building because they do look to the cleaners to keep things safe and healthy. The article also talks about how many endings have been very, very messy. Messy. I'm not sure exactly what they mean by that, but I assume it's maybe calling things at an end when they shouldn't have ended. So
a lot of, again, I teach disaster medicine. I have done for years, Jeff, and disasters and emergencies happen at the local level. Mm-hmm. The challenge we have is from our political leaders. They'll try to say, well, all of the country needs to look like this. Or the state governors will say, all of the state needs to look like this. No, disease transmission occurs at the neighborhood level. And again, as we've seen, there are some neighborhoods in this country that have been hit really hard. There are some neighborhoods that still haven't seen any cases of COVID-19, but they still remain highly vulnerable to a new virus. And so it's really important that we both have our data based on location, space, and time. So when and where. And it's important that we are able to share that information with the community, with the population at large, going, here is your risk at your neighborhood level. Here's the risk when you're going to this event. Here's the risk when you're going to work, when you're taking public transport. And we can do better at that. So it's not a one size fits all. It's based on risk assessments at the local level of where active virus is being transmitted between people. And it's actually so important that we maintain that physical distance and we clean and disinfect appropriately.
Yeah. So this pandemic that we're in right now, who calls it over when it's time? Is that the World Health Organization?
Well, the World Health Organization declared the pandemic. The challenge we're going to have right now is, what are the indicators? What are the critical pieces of data and information we need to say that, oh, the pandemic has now ended? And that's really challenging for us, again, because everyone, 7 billion people in the world, this is so new to them right now of seeing a new virus. It may go on for months, may go on for years. We just don't know now. What we do know is that we can prevent transmission. We can protect people. We can do it appropriately. We may have to look at this new normal through the lens of it's going to be a long time. We don't know what it's going to do when we get to the next flu season, when it's cold in winter, how this virus will act with other viruses that causes colds and pneumonia and flu in winter. We'll have a lot of lessons learned from the Southern Hemisphere as they go through their flu season now. But I think people have to prepare that this is the new normal. There's a lot of things we can do. There's things that we have to do differently, and we need to stick with that.
Yeah. Well, thank you. This article, again, the headline is, when is a pandemic over? No way to answer that question right now. So
no clear answer, Jeff. And I'm unfortunately, I can't give you a clear answer, because I think you and I would make $1 million if we knew the answer, but we can't do that.
Can you give us a maybe or a what if?
Again, we're seeing the research right now for a vaccine. There's over 100 vaccines being tested right now. I think that's exciting and encouraging, but we just don't know. Once we get the development of a vaccine, then it has to be manufactured, and then we need to actually prepare that vaccine and manufacture that vaccine for the numbers, the millions of numbers that we'll need to actually administer the vaccine. We need to train people with the vaccine. So there's a lot of things that still need to be done. We're not over from this. It's not going to happen this year. Definitely, no way in the world.
Yeah, and I know you don't deal with maybe, so we'll deal with the facts.
There you go.
All right, thanks.